U.S. Surgeon General Vice Admiral Vivek Murthy. Dr. Murthy's highest priority is building a stronger and healthier America. He's here to talk with us about today and his vision for improving the national public's health. And guess what? He wants our help. So please join me in welcoming Dr. Vivek Murthy.
Thank you so much, Barbara, for that kind introduction. And thank you so much to all of you for your warm welcome. How's everyone doing today? Good? Glad to hear it. I want to join in congratulating you and welcoming you to today's and this week's event, but also, most importantly, to wish you a very happy 50th birthday. Now, when it comes to Barbara, I know that many of you know her well, and a lot has been said about her and her leadership. But over the last 7 years, the men and women of the NRPA have known that they have one of the best leaders around. And over the past 9 months as Surgeon General, I have seen firsthand just how committed you, Barbara, are, how committed your team is, and how committed your members are to ensuring that the parks and recreational centers all around our country are in fact the center of our communities, which is what they should be. Many people don't realize that these parks and recreational centers are also centers of health, that they're not just places where people go to enjoy themselves, but that in doing so, they also build a foundation for a healthier life. And some of you may also know that last week, I announced the release of our call to action, focusing on walking and walkable communities. This was an important first step in reclaiming the culture of physical activity that we used to have in America. But it was also the first step and an important moment to clearly state that everyone in America deserves a safe place to walk and to wheelchair roll. Sadly, that is not true for everyone. Just earlier today, in fact, I came from Myrtle Tate Elementary School, where I had the great privilege of joining parents and teachers and school children as they walked to school. And it was an extraordinary experience to be there at what was such a festive event, where kids and parents were walking hand in hand and teachers were waiting with outstretched arms to receive them. It was a picture of what our schools and communities could be like. But it was also the story of the challenges that communities face to walking. There at Myrtle Tate Elementary, the teachers and administrators told me that the crosswalk, some of which we were standing right in front of, didn't have enough stop signs. And I saw myself firsthand how dangerous it was for kids to be crossing the street without the presence of actual crossing guards. So we have safety issues that we need to address, even right here in Las Vegas. And that's why I'm glad, and we were glad in the call to action, to focus attention on the need not just for walking, but for walkable communities as well. We also launched this call to action because the science on walking and physical activity is clear. We know that just an average of 22 minutes a day of physical activity, moderate physical activity, allows you to decrease your risk of diabetes and heart disease. And just by show of hands, how many people here know somebody who has diabetes or heart disease? Almost everyone in this room. These are some of the most common conditions that our country faces. And in fact, they're conditions that affect millions of Americans and cost us dearly in terms of dollars. But 22 minutes on average of moderate physical activity, which you can get by walking, can help reduce your risk for these illnesses and for others. But walking and getting people to walk isn't always easy. There are the safety issues that we talked about earlier. But sometimes it's hard just to get people motivated. It's hard to get them the message. Now, I know this firsthand because for years, I have been trying to get my mother to walk. And for those of you who have family members who we've been badgering to either go to the gym or walk outside or eat healthy foods, you know that convincing family isn't always the easiest thing to do. So I've tried all kinds of techniques. I've tried walking with my mom when I'm at home. Unfortunately, I don't live in Miami where my parents live, so I can't walk with my mom every day. Yeah, a round of applause for Miami. It's a good city. Proud to be from there. So a couple of days before we released the call to action, I said, you know what, let me give this one last shot with my mom. And I called my mother and I said, Mom, on Wednesday, we are releasing this call to action on walking in walkable communities, where we want to make walking a national priority and create a whole nation of walkers. And I said, if we launch this call to action, it's going to look really bad if the mother of the Surgeon General isn't walking. So she paused and she's like, you know, that makes sense. And then my father called me the next day. He said, you know, your mother is checking her iPhone every 15 minutes to see how many steps she's getting in. She's really walking. So do whatever it takes. So my first request to you today is really simple, and it's to help ensure that my mother isn't the last American to make a commitment to walking and to active living. But the good news is I know that she will not be the last. And I know that I have all of you, in part, to thank for that. And it's not just this session at 2:30 p.m. that's happening, I know, later today on how to put the call to action to work in communities. I hear from impartial sources that that's a very good session, so I encourage you to attend. And it's not just the terrific video that we saw, the infographics that you've put out, encouraging members in your communities to be part of this physical activity movement. The reason I think that we are going to be successful in this is because of the work that you're doing each and every day in neighborhoods, working hand in hand with community members, with elected leaders, with city administrators, to help make our communities more amenable to physical activity. And I believe that in this vein that there are three things that we can really agree on. The first is that parks make our communities better, more desirable places to live, to work, and to play. The second is that each of our communities are unique. And that means that it's going to be incredibly important to have people like you who are professionals who understand their communities, who are deeply rooted in their neighborhoods, who can help build and create the policies that can make those neighborhoods more walkable. And third, we can agree that when people have access to parks and to green spaces, they will have the opportunity to lead more active and healthier lives. This is so important at a time when 3 out of 10 Americans live in neighborhoods where there are no sidewalks. It's important at a time where chronic diseases like diabetes and heart disease, like cancer and others, are responsible for 7 out of every 10 deaths in America, and also cost us over $1 trillion a year. More than ever before, we need parks, and we need them now. We need recreational spaces where people can be active. We need to reclaim that culture of physical activity in America. And you are the ones who will make that success possible, because you are the leaders in our communities. You are the ones responsible for preserving and maintaining the heart of so many of our neighborhoods. And I know that with your support and with your leadership, that we will help make more Americans not only healthy, but we will enable them to do it by stepping it up, by walking, and by helping others to do the same. I know that we've all seen in our own work what can happen when communities take this to heart. We can see what happens when they're provided the support and resources that they need to improve infrastructure in their neighborhoods. But we've also seen what can happen when communities take initiative, even in spite of not having resources. We've seen it in particular in places like West Wabasso, Florida, in Indian River County, where 11 years ago, more than half of the population were living below the poverty line. The roads were unpaved, there were no sidewalks, there were no streetlights or safe public parks. But then the community made a decision to come together and to change this. And over 2.5 years, the Indian River County Health Department worked with the residents and the government of West Wabasso. Together, they created safe public places for walking. They installed streetlights and sidewalks, and they improved local parks. And when they were finished, 95% of residents said they spent more time outside than just 2 years before. 95%. And when asked why, they credited the improved lighting and the increased availability of walkable spaces. Now, we know why all of you are here today. You're here because you are the ones who are putting ideas like what happened in West Wabasso into action. But what about me? Why am I here? Why did they ask a physician who's dressed in a uniform that sometimes gets mistaken for an airline pilot to come and speak to the NRPA? And that's a true story. I do get mistaken a lot for an airline pilot. The other day, I was boarding an airplane with my aide, Lieutenant Annetta, who's here with us today. And the woman in front of me, right as we were about to step into the plane, looked back and said, "Oh, why don't you go ahead, sir?" And I said, No, please, you go forward. It's, you were first. She says, without you, we're not going to be able to fly the plane. You should go first. So I have to disappoint a lot of people when I tell them I'm not an airline pilot. But the reason that I'm here is that we live in a time where we have lost touch with the culture of physical activity that we used to have. We live in a time where a lack of activity has become a barrier to health. And we live in a time where, unfortunately, where you live can be an all too accurate predictor of how healthy you are. This is a time when health disparities, unfortunately, continue to grow. So part of what I'm here to do has to do with this uniform, in fact, serving as the head of our United States Public Health Service Commission Corps, a dedicated group of over 6,700 public health professionals all across the country and across the world. These are dedicated professionals who many of you may have met and worked with, but who help each and every day to keep our communities safe, and who also respond during times of disaster, like 9/11, Hurricane Katrina, Hurricane Isaac, and most recently, the Ebola outbreak in West Africa. In addition to the Commission Corps, part of my job also involves issuing calls to action in Surgeon General's reports, as I did recently on Wednesday. But mostly, and most importantly, this job, the job of being Surgeon General, is about bringing people together to find ways to address the real public health issues that are facing our country. And that's where all of you come in. Because today, we live in a moment in our history where there's more information available than ever before. A moment where advancements in science and medicine and research can help us lead longer and better lives. A moment where we can re-examine the impact that the most fundamental actions that we take, like walking, have on our health. This is a moment where every American should have the opportunity to take a simple step forward for their health based on facts. And I believe that parks and recreational areas have to be central to that effort. So I'm here to ask you today to be a part of something, to be a part of a movement that involves all of us educating our friends and our neighbors, part of a movement that recognizes that fighting for green spaces in all of our communities is nothing less than a public health battle. A movement where I'm ready to stand shoulder and shoulder with you in implementing. I'm ready to stand with you as a partner in public health. I'll leave you with this story, a story that some of you may know. The story of a young man from Kokomo, Indiana. It's the story of Ryan White, a young man who had hemophilia and who 30 years ago contracted HIV through a blood transfusion. He not only fought his disease, but he also fought the prejudice and misunderstanding of so many people in his community But despite all of that, he and his mother inspired others. They inspired people like Jill Stewart, the student body president, who helped recruit scientists and experts to educate her fellow students about the disease. They inspired lawmakers to pass the Ryan White CARE Act, which led to a program that now treats over 500,000 Americans in communities all across this country. I was at the White House last week to celebrate the 25th anniversary of the Ryan White CARE Act, and I met with Ryan's mother, who reminded me that the struggles of any of our neighbors must be our struggles too. She reminded me that the challenges of any community must be our challenges too. We face big challenges in our country. We read about these challenges every day. These are challenges that threaten our health, and they threaten our future. But never ever believe that these challenges are bigger than our collective will, because they are not. The question that lies before all of us is, what kind of America do we want to create? What kind of America do we believe the next generation deserves? And I believe that if we work together, not just at conferences like this one, but every day throughout the year, I believe that we can build the infrastructure our communities deserve to remain healthy and to remain strong for generations to come. Thank you so much for everything you do, and thank you for having me here today.
That was great. Thank you. Appreciate it.